Hello, and welcome to the Clinical Care Options Infectious Disease Podcast. I'm your host, Jacqueline Meredith. Today's episode is the second of an ongoing series addressing collaborations in care during the course of hepatitis B infection, featuring brief conversations between a physician and a patient. In this episode, Dr. Robert Wong has a discussion with a patient, Evelyn, who shares her experiences living with hepatitis B, highlighting opportunities to improve education provided to patients. For the full online educational program, including medical minutes, downloadable slides, clinical thought commentaries, and other podcasts in the series, please visit the link in the show notes for this episode. And to get access to all of our new podcasts, subscribe to the CCO Infectious Disease Podcast on Apple Podcasts, Google Podcasts, or Spotify. Now let's get started.
Well, welcome everyone. I'm Dr. Robert Wong, GI Hepatology at Stanford University School of Medicine and VA Palo Healthcare System. And today I'm here with a good friend, Evelyn, who is living with hepatitis B, seen by a different provider. And our goal today is really to talk to Evelyn to learn about her journey with hepatitis B and highlight some opportunities where healthcare providers that care for patients with hepatitis B can improve the monitoring and care coordination that we provide. So hi, Evelyn. Welcome. How are you doing?
Good. Thank you. Thank you for having me. I'm doing well. I'm
Great.
excited to be here.
Sounds good. So maybe the first question to really hear your experience is if you could tell us a little bit about how you were diagnosed with hepatitis B and how you sort of first found out about the diagnosis.
Yeah. So when I was 17 in high school, I volunteered for a blood drive and got a letter back saying, sorry, we can't use your blood. We tested it and you have hepatitis B. And at the time when I got the letter, I was just like, what is this? How did I get this? Is this an STD? I'm not sure. And then I asked my mom at the time, and she just very nonchalantly was like, yeah, you were born with it.
Hmm. So was this, that sounds pretty surprising. Was this the first time you heard about hepatitis B?
Yes. And so
Okay.
it was definitely very surprising that it was coming through a third party letter.
Yeah. It was probably pretty scary for you. What was going through your mind at the time when you saw this letter or got this notice?
I honestly didn't know how it was going to affect me, but I felt like it was going to affect me. The fact that, it was just like on paper, you have hepatitis B. I think I did like a quick Google search
Yeah,
and was
yeah.
like, oh, it affects your liver. But really, I didn't know that much about it. I honestly didn't understand like the answers that I got from the Google search that
Yeah.
much. And my mom was just like, oh, you were born with it. I got it from your dad. The
Yeah.
end.
Yeah. Yeah, it's always tricky when we resort to Google because we find some informative, some not so informative information that sometimes can be pretty scary in the wrong context. So after you found out, when did you then seek out guidance from a provider?
So around that time, so once I found out, my mom brought me to her GI specialist
Hmm.
at the time, and he kind of walked me through it, drew some diagrams. But now thinking back on it, I think I honestly was still in shock at the
Yeah.
time and just trying to take it all in. And so just kind of thinking back, like if maybe I had revisited the topic a few months later after I'd had, time to digest and just kind of put together some questions and just kind of get another
Hmm.
explanation just with a clear head.
Yeah.
I feel like that would have been a better start.
Yeah. Hepatitis B is quite complex, and if you try to learn everything in a 15-minute session, you'll go crazy trying to really understand. So this was a gastroenterologist. Did you also have a regular primary doctor that you were seeing?
Yes.
Oh,
Okay.
okay.
Mhm.
So so you had two providers. After this initial visit, did you do follow up with this GI person or your primary doctor, trying to understand, what kind of additional education or information they were able to offer you?
I think I did maybe 1 or 2 follow-ups with the GI specialist, and then I think we did an ultrasound and kinda just got a baseline of
Hmm.
everything, and then after that, I think we changed, providers, so
Hmm.
then, we kinda had to switch the whole system around and get new doctors,
Yeah. Yeah.
so then I ended up with both a new primary care doctor and a new GI specialist.
Oh, okay. Did they continue to follow up with you about the hepatitis B, whether it's, more testing or more evaluation?
It was essentially just more blood test,
Okay.
and that's about it until my levels started to go up when I
Okay.
was, 22.
When you were initially being seen and sort of during these follow-ups, did you get a good sense of sort of what the long-term plan was with hepatitis B, like what to expect, what's going to happen with treatment or not treatment? Did anyone give you a sense of kind of how it would affect your life long term?
I feel like they probably did in those first visits, but just with, the surprise of it all and just trying to take it in. And at the time, like, my levels were normal, and
Hmm.
so there was no talk about treatment at for myself at the time.
Yeah, it's always, we try to kind of say the same things over and over on multiple visits because, even for us as providers, hepatitis B is pretty complex. And hearing it over and over across multiple visits sometimes helps drive home some of the key points or the key education concepts for patients long term. When you were, I guess, transitioning from that sort of discussion about testing and monitoring, was there a discussion about you talking with your other family members about testing for hepatitis B or any guidance about, reducing the risk of transmitting hepatitis B?
There was some talk about just kind of sexual partners, like for
Hmm.
future partners and whatnot, just to be having safe sex practices.
Yeah,
But
yeah.
then talking to other family members, I don't think that came up. I think the first doctor knew that my mom had it since he was her GI specialist. And so I think maybe he assumed that we all knew, but just like the Asian culture of just kind of not speaking about certain subjects, like certain subjects are taboo and just you just kind of live with them and don't really talk about them.
Yeah, yeah, I mean, you bring up a really good point because, as many of us here know, hepatitis B predominantly affects Asian Pacific Islander communities as well as individuals from Africa. How do you think potential cultural barriers may have affected talking about hepatitis B? Maybe it wasn't really talked about early on as you were a child because it's just not something we do as Asians.
Yeah, I think when my mom found out, she was still in Asia,
Hmm.
or I honestly haven't had that conversation with her of when she actually found out, but I don't think she brought it up with her family. She didn't bring it up with me as a child, and I think it just wasn't something she expected me to have to deal with so
Yeah,
early on, and that it was just gonna be something that would be coming later in life and that I
right.
would just learn then.
Right, right. So then moving on, so you were diagnosed sort of in college, had some follow-up. Did you eventually need to start treatment for hepatitis B?
Yes.
Okay.
So about 5 years after I learned that I had hepatitis B from the blood drive, my regular tests started to go up.
Okay. And
And
and and they
so,
started you on treatment at that time.
I think we monitored for about few months before
Okay.
they put me on just, "Here's a medication you're gonna go on, and you're gonna stop drinking, and we're gonna see how this goes."
When you were starting on treatment, did you get a sense of is this going to be lifelong therapy or we're going to treat for a little bit and see what happens? Did you get that sense from the providers?
I honestly didn't. I felt like they didn't really give, like, a hard answer, right? Because
Mhm.
they honestly didn't have a hard answer because we
Yeah.
have to just kinda see where the test results how I, react to the medication.
Mhm.
And so when I first started the medication, I honestly thought that this is going to be the rest of my life. Like this
Yeah.
could be several, like 10, 15, 20 years of just being on medication.
Yeah. Yeah. That you're young, healthy, you're at the prime of your life. Was that concerning for you that this could be sort of a chronic, lifelong kind of therapy?
Absolutely, especially at 22, right?
Yeah.
It was right after I became a legal drinker, and
Yes.
I was just out of college and wanting to, spend time with my friends, and just it kind of affected the way that I kind of started going out and kind of going out less to,
Yeah.
just not be in those situations where I was around alcohol and
Hmm.
having to explain the whole situation. That definitely was something that was a little difficult for me, of just kind of having to give the whole backstory of, like, it's, it is technically an STD in some cases, but you're born with it, and having to explain that whole history was a lot. And so I felt like I definitely retreated from some social situations because of it.
Yeah, that's, one of the themes we hear a lot is that this perception and stigma associated with hepatitis B. And we're trying as a community to kind of reduce that. And one of the things we're doing is recommending universal screening. So you're not testing for hepatitis B because you're high risk or whatever. Everyone should be tested, everyone should be vaccinated, and really kind of reduce that stigma associated with hepatitis B. Were you continued on treatment or did you stop treatment at some point?
So I ended up being on treatment for about like a year and a half or two,
Hmm.
before my levels started to go down. And then at one point, my doctor said I didn't need to take the medication anymore, and that we
Okay.
would just continue to do the regular blood test.
Okay. Okay. And during this time, you're still following with like a GI or hepatology provider regularly?
Yes. Mhm.
Yeah. And were you getting resources from any other providers or education, like your primary, or where did you go to get more information about hepatitis B?
It was honestly primarily my GI doctor, a little bit of Google, which
Yeah. Yeah.
probably didn't help too much. And then I kind of found some resources for Hep B, people with Hep B. They're just like some groups online. And that kind of helped me feel like I wasn't alone, since
Yes.
I'm the only person my age that I know who has hepatitis B.
Yes.
But then just reading other people's stories, it definitely made me feel like we can make it where it's not a stigma at some point.
Yeah, absolutely. I mean, I think, provider education is important, but, you go to see a provider, you have maybe max 15, 20 minutes, right? And I think, as you pointed out so well, there are very valid or good resources out there. Hepatitis B Foundation is one organization that has a lot of patient-directed education, a focus group, community groups. So really to network with other people who are living with hepatitis B, and as you said, to realize you're not alone. Many of the issues and struggles that you may have are shared similarly with other individuals, and it's a good opportunity to kind of talk and network and share experiences. So, so now you're doing well. You're not in therapy now, but you're continuing to get monitoring.
Correct.
Thank you for sharing this experience. I think this is such a valuable experience to hear about your journey, your diagnosis, the kind of initial education, and maybe areas where we can do better about sharing with patients how best to coordinate with the hepatitis B care that they receive. Yeah, so thanks so much for sharing your experience. To kind of wrap up the session, want to hear what advice or guidance would you have for patients and providers, actually, as a take-home point to kind of improve how we approach hepatitis B and provide, good care for you and other patients in the future.
I would think definitely ask all the questions, especially trying to get things in layman's terms. getting diagrams drawn out. I think that the little drawings that my first doctor did, like my first visit, I think I saved those for years just so I could look back at them because they made sense to me. And then something else that kind of I wish there was more of is just kind of the education part for mothers with hepatitis B, since I feel
Yes.
like my mom could have been better educated and had resources in order to tell me, right? In order to teach me about hepatitis B before I find out through a blood drive.
That's great. Definitely thanks so much for sharing your experience. I think you highlight a lot of key areas where we as a field can improve the way we talk about hepatitis B and improve the care that we provide for patients with hepatitis B. And one thing I highlighted earlier that I'll highlight again is a lot of this work that you and other advocacy groups have done has really shifted the way we approach hepatitis B. And now we recommend universal hepatitis B screening for everyone and vaccination as well. So that's a key important development that happened in the last 1 to 2 years. With that, I want to thank you again, and thanks for those that are listening.
Thank you so much.
Thank you very much to Dr. Wong and Evelyn, and thank you to our listeners for joining in. As a reminder, to view the full Mind the Gap, Aligning Real-World Practice with Best Practice in HBV program, on the Clinical Care Options website, click on the link in the show notes. And please be sure to check back for more episodes on important infectious disease topics. Thank you and have a great day.